The MedTech Adopt a Cove and Rescue Station program evolved out of the MedTech Bystander Rescue Care program founded by a Cub Scout and his family with a gifted teacher and the leadership of national medical and security experts from major medical centers. The program teaches the public critical emergency bystander care skills to help save lives for the 8 leading causes of death in those vital minutes before professional first responders arrive. It started with Boy Scouts and lower, middle, and upper school students and their families, has spread to leading universities starting with its launch at Stanford, and is now expanding across California, Texas, Minnesota, and Florida through a growing instructor network. A lifeguard surf program led by Charlie Denham, a MedTech founder, and Preston Head, a former Laguna Beach lifeguard and UCLA water polo star, is expanding from Orange County to as far away as the Hawaiian Islands through ocean rescue experts who will train schools, scouts, faith-based organizations, and the public. Our gifts of tourniquets and trauma care supplies, CPR Bluetooth-enabled simulators, and self-contained packaged Stop the Bleed kits that anyone can assemble have been very well received in California and Hawaii. Recent near-death experiences from major bleeding events, such as the one at Emerald Bay and Laguna Beach, led the MedTech team to provide 2 tourniquets for every lifeguard tower at beaches in Laguna and Waikiki. Through our collaboration with the lifeguards, professional first responders who have to deal with beach terrain, and emergency medicine physicians who have to serve along our coastlines, we found that the response to care times to beaches can be much longer than the average urban response time of 10 minutes. We know that survival drops 10% for every minute without CPR and the use of AED for out-of-hospital sudden cardiac arrests, of which we will have 1,000 every single day in the United States. We serve at local and national surf competitions where we train surfers, surf teams, coaches, their families, and the public. We train everyone in bystander rescue care from 8 to 80, from the youngest micrograms to seniors, from beginners to big wave surfers. There are very common injuries that shortboard and longboard surfers, boogie boarders, and body surfers sustain. A little good Samaritan know-how can go a long way to keep them safe and back in the water when they recover. Our MedTech leaders are getting national recognition for combining ocean rescue with rescuing our oceans. Our environmental science projects are in microplastics reclamation with leading university innovators, and our environmental STEM education programs are being delivered to middle and upper schools. Professional first responders are taking our courses and undertaking R&D with us to reduce response to care times through fixed and mobile rescue strategies. Their innovations are being featured in our global documentary broadcasts, podcasts, and medical papers. The goal of our Adopt a Cove program is to get life-saving automated external defibrillators and bleeding control supplies placed at each beach so that there is less than 3 minutes from drop to shock for sudden cardiac arrest and less than 3 minutes to stop bleeding from any traumatic cause at the beach. Individual donors have stepped up to pay for a care pack with an AED and trauma Stop the Bleed kits, or all-weather care cases placed at lifeguard towers or at the most visible locations at the beaches. The individuals and families that have donated the funds for the care packs and care cases for local beaches have led the way to inspiring businesses to do the same. Local businesses, such as Killer Dana Surf Shop, are helping raise funds for a cove, such as with the Start a Wave, Save a Life t-shirt sales initiative. And they are sponsoring free MedTech training programs specifically for our avid surfers and boogie boarders and skateboarders who are at risk for very specific injuries and for those who work and play at our great beaches. The Eagle Squadron is a group of Eagle Scout candidates who are earning their Eagle Scout rank, the highest rank a Scout can attain, by placing MedTech rescue stations at beaches, schools, and parks. The entire group works together as a team to help each Scout develop the most ideal rescue station that will save the most lives at its location. They are advised by a world-class group of critical care and emergency medicine physicians, biomedical engineers, threat safety experts, first responder and emergency response leaders, EMTs, nurses, lifeguards and ocean rescue experts, film and performance art students, and Scout leaders. Our team of Life Scouts and student leaders, with the support of our medical expert advisors, have placed and are placing rescue stations and rescue gear at schools, churches, scout camps on Catalina Island, and at our great beaches and coves. Some are fixed units, and many are mobile configurations on bicycles, golf carts, and security vehicles. We're working closely with state, city, and private lifeguard groups, law enforcement, firefighters, and emergency medicine leaders, as well as surf event conveners, to optimize placement of rescue gear. The objective is to map the rescue care to the population kinetics at the beaches and surf breaks. Portable units on e-bikes, golf carts, and backpacks can be deployed at peak times and at peak locations during special events. The team is continuously surveying our beaches and coastline from San Onofre to Newport Beach, including each of the harbors, to identify the best locations for rescue stations to save lives. Harbors are important locations in light of the density of the population, the added risk of watercraft and water sports, the inaccessibility of victims by EMS, and because mobile phone GPS location will not help EMS dispatchers direct professional first responders the way a land-based dedicated 911 phone line will to a direct address. Using rangefinders, satellite maps, and by calculating the walking speeds of the general public, the team identifies the best sites that will ensure 3 minutes from drop to shock for sudden cardiac arrest and 3 minutes to stop severe bleeding through bystander rescue care. Our student leaders work directly with the professional first responders and community leaders to pick the location and signage to allow the general public to have access to the bystander rescue gear. Our teams are even using state-of-the-art drone video capture techniques to document rescue care scenarios and the emergency response to care times. These are really helpful for larger geographic areas and those locations where peak traffic times and distance can impact EMS response times and therefore survival. Our goal is to make rescue supplies accessible 24 hours a day, 365 days of the year. Emergencies don't just happen during business hours. We have many firsts, such as signage and training to address our diverse multilingual public attending worship services and schools, and development of integrated threat and rescue station safety reports for city and county leaders that apply idealized design engineering concepts to bring their communities up to the standard of care. Organizations have more and more liability each year for not providing rescue gear to the public. The 2 rescue station solution at the Ocean Institute in Dana Point is a real Pathfinder example that meets a critical need with a history of prior rescues. It has raised the standard of care for the entire Dana Point harbor. The mobile rescue stations we are placing at hard-to-get-to surf breaks, such as Lowers at Trestles Beach in Southern California, shave vital life-saving minutes off of rescue to care times, where CPR and AED use early could have saved lives in recent years. All sites and rescue gear are approved by the lifeguards and professional first responders that serve the locations. Rescue gear, placement, signage, a website, and a briefing video are all produced by the Eagle Scout candidate through their project. All Eagle candidates must be certified in CPR and AED use at the same level that doctors and nurses do to maintain their licenses. Our Scouts must also be certified by the American College of Surgeons Stop the Bleed program for severe bleeding control, and the Scouts assist in our community training programs. They serve as assistant instructors in our community training of the public and our Train the Trainer programs where we certify law enforcement officers, firefighters, EMTs, and lifeguards. This allows us to keep expanding our program across communities. 1, 2, 3, MedTech!
We are looking forward to other Scouts building rescue stations for beaches near them for the Eagle Scout project.
Every rescue station is unique. Our young leaders work with the local lifeguards, EMS, first responders, and the community to synchronize the rescue gear with what they already use and need. The rescue stations provide an opportunity to teach the community about bystander rescue care, including how to make the best 911 call, the latest updates on cardiopulmonary resuscitation, CPR, and stop the bleed skills, how to care for severe bleeding, including the use of tourniquets, pressure, and wound packing. In 2022, our MedTac youth leaders who are competitive surfers and our instructors began teaching bystander rescue care to competitors and spectators at Southern California surf meets. Surf coaches, high school students, and their parents and siblings are learning rescue skills between heats. High school students and scouts are earning service hours as they contribute to their communities. Our student-led Surf Great, Surf Safe podcast and live webinars will be tackling water safety from the home pool to the beach and emphasizing drowning prevention in children and rescue care of beachgoers. Drowning is a leading cause of death, and many families have missed swimming lessons during the COVID crisis. Finally, we are expanding our efforts to help teach our youth about total cove care, how to protect and prevent harm to our sea creatures as we enjoy being guests in the bays and in the coves that are their homes. The oil spill off our California coastline has allowed us to help engage students, teams, and schools in not only focusing on failure to rescue of humans, but also to prioritize failure to rescue the very fragile ecosystems of our bays, coves, and harbors. The Ocean Rescue Our Ocean graphic captures the essence of the total cove care concept around one location or surf break, battling failure to rescue of the entire ecosystem, both of beachgoers and the marine life that supports us. 4 lives have already been saved through our members of our core team in their daily lives. We honor them with our Soaring Eagle Award. The hundreds of people from 8 to 80 who we've had the blessing to train and the instructors we certified are likely having even more impact. They and the wonderful community leaders who have supported our cause will be featured in the global broadcast documentary, 3 Minutes and Counting, Bystanders Care. This is a 3rd broadcast film following Chasing Zero, Winning the War on Healthcare Harm, and Surfing the Healthcare Tsunami, both distributed globally on the Discovery Channel. Our MedTech leadership team have written 6 articles published in Campus Safety Magazine for universities, schools, medical centers, and faith-based organization leaders. We're continuing to target failure to rescue with new articles forthcoming throughout 2022. We want to thank the families and businesses who have joined our cause. Your gifts will save even more lives. Our donors' tax-deductible donations purchase supplies for multiple Stop the Bleed kits, the best AEDs with a serviceable life of 8 years, COVID-safe rescue gear, and a waterproof care case. We're happy to arrange a visit to one of our rescue station sites. Come train with us during one of our free Zoom or in-person courses. Adopt a cove, adopt a park, adopt a school, or adopt a place of worship. We have wonderful nurses, doctors, EMTs, community leaders, and faith-based leaders from multiple faiths who are standing by to help. We will work with you to help create a gift that keeps giving. The care of our communities is absolutely critical. Thank you for all you're doing to protect those at risk and those who are most vulnerable. As we say to all of our MedTech bystander rescue care teams, we have to fight the good fight, finish the race, and keep the faith. Everyone is a patient, and everyone can be a caregiver.